Well, welcome back. All right, Medicare's open enrollment deadline is looming, and I caught up with United Healthcare's health plan CEO to find out why open enrollment is so important. Take a look.
We're almost at the end here of the annual enrollment period. It's so important for everyone on Medicare to make sure they've got the right plan for 2018, and that's both for their well-being and their wallet. For most people on Medicare, this is the only opportunity they have to make sure they have the right plan for 2018. This is why I really want to make sure if you've not taken the chance to take a look at the plan choices you have, you definitely do that right now. I don't want you to wake up on Friday morning with the wrong plan. That would not be good.
All right, let's get into some nuts and bolts here. You know, Part A, Part B. Talk to me about the difference of those.
Well, you're right. Medicare sometimes feels confusing with that alphabet soup, but the good news is there's really no change in structure for 2018. We're going to continue to have original Medicare that's got Part A and Part B. Part A focused on paying for your hospital care or when you're in a skilled nursing facility or that increasingly important hospice care. Medicare Part B, the other half of original Medicare that's focused on paying for doctor visits. When you're in the doctor's clinic or the doctor's in the hospital, covers outpatient services like emergency room, covers lab, x-rays, those kind of services, some preventive care. The most important thing to remember about Medicare Part A and Part B is there is cost sharing, and there's no limit on what that cost sharing might be. On the other hand, you have Medicare Part C, the Medicare Advantage programs that bring A and B into a single package, typically building in that prescription drug benefit. Plans are offered by private companies like United Healthcare. And then finally, Medicare Part D. D for drugs. You either get your Part D built into your Medicare Advantage program or you buy it separately. There's nothing automatic about Medicare Part D, so this is why it's so important, again, that you're shopping to making sure you've got the right plan for 2018.
I want to ask you about Medicare Advantage. You mentioned it there, and it's seen a lot of rapid growth in the last couple of years. Talk to me about why you think, what's driving that growth?
Well, you're right. We've seen 50% growth in Medicare Advantage enrollment over the last 5 years. Today, 1 out of 3 Americans on Medicare has selected a Medicare Advantage plan. I think the main reasons are reasonably straightforward. First and foremost, Medicare Advantage brings simplicity and value into a single package, all those A and B benefits in a single program. Typically, people are paying co-payments. It's easier to navigate. There's making sure the prescription drugs are built in most of Medicare Advantage plans. Frequently, people can get a Medicare Advantage plan without having to pay much in the way of additional benefits for that. Medicare Advantage is continuing to include things like hearing aids, vision care, dental services, transportation, things traditional Medicare still isn't paying for. And then finally, there are those wellness programs. So many Medicare Advantage plans, just like United Healthcare's, offer things like fitness club memberships and house calls program to have a nurse come to your house and make sure you're getting the most out of your healthcare experience.
Well, Chris, we got to wrap it up here, but for those out there watching, I know they may have some questions. What are some resources they can tap into?
Yeah, absolutely. The best thing to do is go to uhcmedicareplans.com. That's uhcmedicareplans.com. Check out our plans or give us a call today, 1-800-UHC-6509. That's 1-800-UHC-6509.
Use that number, folks. Special thanks to United Healthcare for bringing that information. The information is not a complete description of benefits. Contact the plan for more information. Limitations, co-payments, and restrictions may apply. Benefits, premiums, and/or co-payments, co-insurance may change on January 1 of each year.